name is Jordynne, and I'm a settler living on traditional territories of the Three Fires Confederacy. I cannot begin without recognizing and expressing our deepest gratitude for the people with lived and living expertise, the Peer Pathfinders, who contributed to this presentation and without whom this project would not be possible. This work has been supported through funding from Health Canada to Public Health Ontario for the COMCAB Community Opioid Overdose Capacity Building Project, as well as in-kind contributions from local partner organizations. These materials and views expressed herein do not necessarily reflect the views of Public Health Ontario or Health Canada. The Peer-to-Peer project aims to develop, expand, and support peer-led outreach and drug poisoning response interventions for individuals and communities most impacted by the war on people who use drugs and homelessness. We accomplish this through community-driven, collaborative, and trauma and violence-informed care approaches. Peer Pathfinders are at the center of the project, providing leadership, determining priorities, and employing their expertise to make connections in community. The Circle of Support team wraps around the Pathfinders as active accomplices and advocates, using our power and privilege to amplify the living expertise voice and leverage resources and partnerships. The Peer-to-Peer project began in November 2020 when community agencies identified a significant gap around peer engagement. Since its inception, the Peer-to-Peer project team has met on a weekly basis, and peer engagement activities occur in various ways. What we have learned thus far and continue to learn is that facilitating a peer-led initiative requires work in 3 areas: meaningful engagement, reciprocal support, and persistent empowerment. Meaningful engagement means valuing process over outcomes. How we do this work is just as important as the outcomes we achieve. These are our terms of engagement and are the result of a facilitated focus group with the Pathfinders and project team, where we sat down together and talked about what we needed to be engaged in the project and remain engaged over time. We continue to assess what is working, what challenges exist, and how we can improve. System-level coordination and support allows us to focus on action at the community level. Support for peer-led initiatives is not one way. It flows through each of these levels in a continuous cycle. As the Pathfinders support folks in community, they learn about emerging needs. They advocate for these needs to the Circle of Support team, who then work to leverage this knowledge and make changes within their organizations. The organizations involved in the COMCAP initiative further expand this knowledge, and together with provincial partners have been able to identify common needs and gaps across initiatives. Empowerment is a continuous journey. So long as systems of oppression exist and continue to marginalize and perpetuate harms for already disadvantaged groups, empowerment will need to be a critical component of this work. As is the nature of peer work, the program continues to evolve as new challenges and priorities are defined by the Peer Pathfinders. This is not a linear process. These goals are interconnected, and one cannot exist without the others. Future directions for our project include evaluation, sustaining the project as a dedicated peer program, and continuing to foster peer leadership opportunities and build capacity within the communities we work with. In closing, we'll share a quote from a Pathfinder with permission after he provided harm reduction training to outreach workers. The photo is from a Pathfinder's home where they provide shelter and harm reduction services for over 50 community members. This board honors the names of friends and family who have died due to the drug poisoning crisis and war on people who use drugs. We cannot imagine how many more names would be on this board if we did not have peers working tirelessly to care for their communities. We end with a call to action to show up for people in your community whose life trajectories might look a little different from your own, who have a voice and a story to tell, who have ideas and solutions to contribute, who do important work and deserve to be seen, heard, and recognized. Engagement, support, and empowerment look different for everyone and for every community. The first step is to show up and listen.